Vestibular paroxysmia is a unique and rarely known cause of dizziness. In fact, we do not quite know how common this condition is. Nevertheless, it tends to affect males more often than females. What happens in vestibular paroxysmia? It is thought to occur due to the compression of the auditory nerve, also known as the vestibular cochlear nerve, located in the brain. The auditory nerve is crucial not just for hearing, but also for maintaining overall balance. More commonly, this nerve can be compressed by blood vessels, especially arteries located in the region of the brain where the auditory nerve is located. It is thought that as the artery compresses the auditory nerve while the heart pumps blood through the artery, it causes the blood vessel to briefly expand and contract, hence momentarily compressing the auditory nerve in the process, leading to abnormal signal by the nerve. This in turn leads to the symptoms seen in this medical condition. What causes vestibular paroxysmia? It can be caused by anything in the brain that compresses the auditory nerve. This includes blood vessels such as arteries and veins, brain tumors, brain cysts, and other medical conditions such as MS, multiple sclerosis. What are the symptoms of vestibular paroxysmia? Symptoms include brief spells of dizziness, at times described as vertigo, room-spinning sensation, lasting for seconds to minutes, accompanied by clicking sounds in the ear and reduced hearing in the affected ear. These symptoms can occur multiple times per day, sometimes triggered by certain head movements, and also by breathing rapidly. How is vestibular paroxysmia diagnosed? The diagnosis is based on the individual's description of the symptoms. In addition, performing an ear examination for potential hearing loss, performing a physical examination, and obtaining an MRI imaging of the brain to see if there is anything compressing the auditory nerve, such as a blood vessel, artery, is extremely crucial. How is vestibular paroxysmia treated? We focus on two very important aspects when it comes to treatment. Firstly, educating the patient on the underlying cause of vestibular paroxysmia is very important. Secondly, focusing on controlling the symptoms that are discomforting to the patient, such as nausea and dizziness, is of paramount importance. Finally, in patients whose symptoms still persist despite the use of medications, surgical treatment may be an option. Here are a few questions you may ask your doctor about vestibular paroxysmia. What is the cause of my symptoms? Can my symptoms recur after it is treated? Can I pass on this condition to my children? What are my treatment options, and are they effective in completely eliminating my symptoms? Can a stroke cause similar symptoms to vestibular paroxysmia, and if so, how can I tell the difference? What should I do if I think my symptoms are due to stroke? Here are take-home points on vestibular paroxysmia. Vestibular paroxysmia is caused by blood vessels compressing the auditory nerve in the brain. Symptoms include brief multiple dizzy spells, at times accompanied by clicking ear sounds. Diagnosis includes performing a hearing test and MRI brain imaging scan. Treatment typically involves the use of medications to control symptoms, but in some cases, surgery may be needed depending on the underlying cause of the vestibular paroxysmia. Ready to try a few practice quiz questions on this topic to test your understanding? Question 1. What is vestibular paroxysmia? A. A type of diabetes. B. A type of stroke that leads to difficulty speaking. C. A type of stomach infection that causes severe diarrhea. D. A type of severe headache that causes nausea. E. A medical condition that triggers brief bouts of room-spinning sensation, known as vertigo. The answer is E. Question 2. Vestibular paroxysmia can be caused by which of the following? A. Lack of exercise. B. High fever. C. A blood vessel such as an artery compressing the auditory nerve. D. Severe drop in an individual's blood sugar level. E. Severe ear infection. The answer is C. Question 3. Which of the following tests is crucial in diagnosing vestibular paroxysmia? A. A chest X-ray to look at the lungs. B. An audiology exam to evaluate for hearing loss. C. An abdominal X-ray to look at the stomach. D. A blood test checking for the kidney function. E. A urine test checking for infection. The answer is B.
Question 4. What are some symptoms of vestibular paroxysmia?
A. Brief multiple dizziness episodes accompanied by clicking ear sounds. B. Neck pain and stiffness. C. Night sweats and weight loss. D. Blindness. E. Loss of sense of taste.
The answer is A.
Thank you for taking the time to learn with us today. We hope that the information presented today was of help to you. If you found this information helpful, click the like and subscribe button for more videos. Until next time.